Pre-2017, we were still allocating lungs based on those very strict geographic borders, the donation service areas. Post-2017, there was actually a change in which the geographic borders became slightly, less rigid. So lungs were allocated in a 250 nautical mile radius. And then post-2023, we have the implementation of the CAS system in which geography really just plays a minor role. So in our research, we wanted to see, how have these changes in the allocation system throughout the years affected waitlist mortality? And one thing we wanted to look at specifically is how has it affected actually the sickest patients on the list?
Mm.
And so just to give some just general numbers, so we looked at the top 5% of patients in terms of medical urgency. So really, the sickest patients waiting for lungs. We found that in the pre-2017 era, waitlist mortality was around 34.5%. In the post-2017 era, waitlist mortality was around 22.2%.
Wow.
And then in the post-CAS era, so post-2023, the waitlist mortality was around 6.5%. That's all for patients in the top 5% with regard to medical urgency. So what we saw, and as you can see from those numbers, is
Mhm.
that waitlist mortality really has continued to improve as we've made these changes to the allocation system. And the change that we've seen has been most dramatic for the patients who are the sickest, the most critically ill on the waiting list, which I think is reflective of the fact that these changes are positive and helpful for patients.